Hi, this is your Sussex County Chiropractor, Dr. Will Holdsworth from Pain Relief Chiropractic. I'm here today with Trisha, who is the head coach at the Strong Together CrossFit. She's in here today because she has a little bit of discomfort and kind of stiffness in her right side of her neck. Her upper back, she told me she feels like it needs to crack, but it's not really moving to the point where it will crack on its own. A little bit of tightness, stiffness in that area. And your knee, she's been coming in for because she's having some issues with that with squats. And you took a break from squats for a while, right?
I did, yeah.
Okay.
It was from a bike ride a long time ago, and it's just continuing to be a pain in the butt.
And what's, just so the viewers know, for what happened on the bike ride?
I just overdid it for an hour.
Yeah.
And it was just a one-time thing, and I couldn't squat or move, barely walk the next day. And ever since then, it's better now, but it still is giving me issues when I squat.
Okay, yeah, and we've been working on it for a couple treatments in here, and we've been doing a lot of muscle work on it and adjusting for it, and it's been feeling a lot better. She did squats, was it yesterday you
Sunday,
said?
Yeah.
Sunday
night.
So Sunday night she did squats. She said she just feels the regular, general soreness that you get from doing squats, muscle fatigue, but no pain now. So we're making some progress with her, and Trisha likes to work out, so by her coming in here, she's able to continue her workouts at the rate she wants to, with the maintenance that we're doing in this office. So that's pretty much everything. No pain today, just tightness in general, just trying to get back ready for the workout for today. You working out?
Yes.
Okay. All right, so let's go ahead and take your glasses off. We're going to go ahead and go face down first.
Okay.
So we'll just work on the knee first.
Okay, do you want my shoes off?
It doesn't matter. And she's been doing a lot of calf stretches because we went over that last time. Her calves were really tight. So we loosened them up with this muscle work that I did in the office. And when I was working on her hamstrings like I'm doing now, I wasn't getting much of usually you get some sort of a reaction when the muscles are really tight. And when I was working on the hamstrings like I am right now, there's not really much of a reaction from her. You may feel like it's a little bit tight in this one spot that I'm on, Trisha.
Yeah.
But compared to the calves last time, it was that was pretty intense. So by having her do the stretches for the calves at home, it accelerates her care here. And I know that because Trisha's really good at staying up on exercising, that if I give her an exercise to do at home, she's going to do it. And I really notice that a lot of times when I tell people to do exercises, if they don't do them, they get better a little slower. But the people who do the exercises, they really improve a lot faster. Because we've only had, this is maybe our 5th visit, maybe the 4th. So it's not really too much that we've seen each other. And she's pretty much all set. She's good to go. This may be our last visit for a while, especially if today when you work out, you're like, yeah, I'm good. Then you just need to come in here when you're feeling a little iffy during some exercises. This pressure's okay?
Yeah.
And or if you're obviously in any sort of discomfort or pain.
Sure.
And Trisha, once again, not to keep giving you compliments, but she was smart to come in today because she's going on a trip. You're going on a flight, right?
Yeah.
So she's not going to be able to come in again for a little bit. So by coming in here while she's available, she's able to stay up on it. How often were you doing those stretches that I told you to do?
Throughout the day.
So more than 3 times?
Yeah. Just when I could, and especially after or before working out. I had, plenty of time in between things to...
Right.
Doesn't take long.
And your low back's doing fine, right?
Yeah.
A little tight, not too bad. A little tight down here. The upper back tightness, that's between the shoulder blades?
Yeah,
Okay.
Towards the neck.
Towards the neck?
Yeah.
Let me know if this pressure's too much. Is this alright?
Yeah.
And I've worked out at their CrossFit gym, Strong Together Chester CrossFit. You have a couple other locations, right?
Yes.
and they have a couple other locations, but I've only been in the Chester one. And what I like about their CrossFit is a lot of people have this negative stigma towards CrossFit because they think you get injured when you go there. But it really depends on the gym you go to. And I was really impressed with the way that they do their gym at Strong Together, because they modify the exercises to help people achieve their fitness goals without getting them injured.
Yeah.
There was a guy in my class who had, I think it was a knee injury. Have you met him by now?
Jack.
Yeah.
Yes.
And he couldn't do one thing, and they tried like 3 different ways to modify it until he could get it right. And he's like, yeah, no pain with this, and it was perfect. So
Nice.
as like a chiropractor, it was really encouraging to see that from your guys' gym.
Awesome. Thank
Yeah, you guys are doing a good job.
We do our best.
You do your best. That's all
Yes.
you can do, right?
Absolutely.
Is this pressure okay here?
Yeah.
So working the shoulders because her upper back is tight, and these shoulder muscles attach to some spots in her upper back. And sometimes people will say their upper back, but it's just that it's so close to their shoulder that it could be their shoulder and the upper back that's involved. Pressure's okay here?
Yep.
So let's keep going. I'm gonna put my hand, you just keep pumping that arm up and down.
Okay.
Good. And I especially want to focus on the right shoulder because it's the right side of her neck that's bothering her. Couple more. Good. Relax it. And we go up. It's cool working with you, Trisha, too, because you have good muscle definition. So you can kind of tell exactly which muscle is
Okay.
kind of picking on you.
Mhm.
Pressure's okay here?
Yep.
It's a little tighter on this side, right?
Yeah.
This wrist is cracking a little bit.
Yeah.
So just gonna move it around, get it adjusted.
Oh, thank you.
Good. And we're just gonna get adjusted here. Go ahead and breathe in and breathe out. Good. And we'll breathe in and out again. Good. Excellent. A little tight in there. Breathe in and then breathe out. Good. I'm just going to lower this down just a little bit. Good, and you can put your head back in there. And get your upper thoracic spine adjusted here. Let me just move your head over to the side. Let's go on your back, face up. A little more comfortable there.
Yeah.
Bend this knee. Good. And rotate toward me. Excellent. Let this fall. Good. Breathe in and out. And flat on your back again. Bend the right knee. And rotate. Good. Let this fall here. Breathe in and out. Good. Excellent. And we'll get your knee adjusted. Good. And let this go. Hip is fine.
Yeah, it's a little tight. And like adductor.
In here.
Yeah.
And when her adductors are tight, it's going to affect her knee. So we're going to go a little light because of the squats. So if it's too much, let me know. You doing all right?
Yeah.
And you foam roll a lot too.
I do, yeah.
How often are you foam rolling?
For a short time every day, sometimes longer.
Right.
Usually before bed or after the workout. But I've taken quite a few rest days, so I've tried to do more on a rest day.
Right. Relax this here. Good. And then hand on your cheek, please. Breathe in and out. Good. And we'll get your neck adjusted here. Then we got to do a little more muscle work on your shoulders with you in a seated position, and you'll be all set. So just loosening up the muscles just beneath her skull. A lot of people will refer to this area as like the suboccipital muscles. And I like doing this specific maneuver or technique because some people, they loosen up after just a couple passes. It really takes no time at all, while some people though, who let things go for too long, it takes a long time to get them loosened up, a couple visits even. So you can see here, you turn her this way and she kind of stops at that point. Go this way and she stops at that point. So her range of motion is reduced in this rotational direction to the left, and then if I go and check lateral flexion, she's reduced on the right side here, which is where that spot is that's bothering you. Mm-hmm. So everything on your neck is, as far as range of motion goes, diminished in the right side of the neck.
Okay.
Because the upper half of the neck does most of the rotation.
Okay.
The bottom half of the neck does most of the lateral flexion.
Okay.
So we'll get her adjusted up top first. And then we'll check again, see if that helped with any lateral flexion, because although the bottom half of the neck does most of the lateral flexion, it also does a little bit of rotation. So I'm just going to see, I like to post check, make sure everything's moving the way it should be. Good. We'll go to the side. Any headaches at all that you've been having?
No.
No. Check again. So she's still a little bit reduced, but that could be even upper thoracic spine. That could be fixated. Good. And we'll check rotation. Now she's there and there. So almost even, definitely more motion going that way.
Yeah.
Let's go ahead and sit up and we'll face the right wall.
Okay.
Or that's fine too. Go that side.
Right wall.
Yeah, that's good.
Sorry.
It's okay.
The other right.
The other right. So we're gonna finish up the muscle work here. And we're just gonna do a little work on this levator scapula muscle here. Take your arm, go out to the side. You're gonna go across your chest and pull that in tight. Good. Let's go back out. Over. Pressure's okay?
Yeah.
So you're going to be out of town for the Super Bowl?
Yes.
Do you have a team that you would pick
Nope.
out of those two?
I
No?
don't. I usually don't even watch it.
You don't even watch it?
Yeah.
Yeah, that's okay.
People on the East Coast are so gung ho over it. Do you?
Actually, I feel like the Midwest is more into football.
Really?
Oh yeah,
Oh.
big time.
I'm
The-
not.
I'm gonna watch it for sure.
Are you?
Yeah, it's kind of like a fun
Is it
time
good
of year.
teams?
Well, it's the Patriots and the Falcons.
Okay.
And the Falcons have this like killer team, but as you know, probably even for someone who doesn't really watch football, the
Yeah.
Patriots are like unstoppable.
Yeah. Yes. I
And
know
that's
that.
tough for someone to say who's a Jets fan.
Right.
So let's relax this. And we're gonna raise your hand like you're asking a question. Put that hand down. Put it on your low back. Good. Up. So we worked almost all your rotator cuff, half of it anyway.
Okay.
Good. It's just a little tight. Yeah, everyone responds differently to muscle work. Some of them are like, this feels great. Others are like, please go lighter.
No,
And we just go at the patient tolerance.
Yeah. You're good about that.
Couple more. And relax. Okay. So, see how you're doing. Try moving your head around. You still have that spot in your neck?
It feels a lot better that way. A little bit when I go back, but not bad at the top.
At the way top?
Yeah.
Okay.
But it feels way, like, it feels like I'm floating a little bit better.
Oh, you're gliding
Yeah,
instead
gliding,
of being kind of
instead
locked.
yeah.
And then what about your upper back?
Upper back feels good.
Good?
The high one that you did felt the best.
Yeah.
Yeah.
Yeah, you needed that.
Uh-huh.
So let's do one more thing. Go ahead and lay on your back. Just make sure, face up. Make sure we got that. All of the, like in here,
It's like, like right here.
a little bit lower. So like
Yeah.
C2 area.
Yeah.
Okay. Good. Let's go ahead and sit up,
Thank you.
and we'll see how that feels.
Yeah, it's better.
Better there?
Uh-huh.